you know what? Felt this was the one place in my career where I could not only help the company save money and spend their money more efficiently, but I was helping all my friends and coworkers be able to not have the increases and all the costs passed on to them like other people did. I could stop that. I could, and I did that by, I'll say this tongue in cheek, but stopping the bad guys.
Welcome to Broken Benefits. I'm your host, Lee Lewis, and this is a podcast where we learn from top employer experts on how to fix our broken benefits to save lives, save dollars, and save your talent. Welcome back, everyone. So excited about today's guest. We're joined by Todd Bisping. Todd is an industry leading innovator, really at the forefront of many of the most important strategies that have come out in the last 20 years, who has maintained potentially the longest string of zero trend years in healthcare of any major US employer or international employer for almost 2 decades. He's a sought after and sometimes difficult to connect with speaker and advisor to major employers, and really has made enormous contributions to the industry. So glad to be joined today by Todd Bisping. Todd, welcome to the call.
Hey, thanks, Lee. Looking forward to it. And thanks for the kind words. Might get my wife in here and let you say that again so she can maybe
Well,
hear that.
we can put it on repeat a little bit.
Yeah, that'd be great.
So, it's sort of starting off at a high level, what's the best part about running a benefits plan?
Oh, that's an interesting question, Lee. If I think back on that a little bit, I never wanted to lead a benefits plan, right? So I think you may or may not know, I'm an engineer by training with an MBA, and I was about halfway through my career, and I'd done a lot of different unique things, but I got a phone call from a gentleman that I'd worked with over the years, and he said, "Hey, I want you to go talk to this guy over in HR. They want to do something interesting with benefits, and they're looking for someone. I think you'd be a good fit." And I just said, hard pass. I have no interest in working in HR. I was just being honest. And so I talked to this guy a lot about career, and he said, "Hey, what's all this about? Don't judge a job by the location and get to know the people and look at the work and look at the, see what the opportunity is." And I said, "Okay, touche. I'll go talk to him." And I went and talked to him and found out that they had set some really bold goals about keeping a healthcare trend flat for an 8-year period, and they weren't even halfway into that period, and they already were at their final target. And so I was naive enough to say, "Wow, this does sound like a fun challenge." I mean, I didn't know anything about healthcare but annual enrollment at the time, so
Yeah.
I thought about it once a year, and so that's when I went over there and I said, how do we make that happen? And what I found out after I talked to everybody over there was, you know what? Felt this was the one place in my career where I could not only help the company save money and spend their money more efficiently, but I was helping all my friends and coworkers be able to not have the increases and all the costs passed on to them like other people did. I could stop that. I could, and I did that by, I'll say this tongue in cheek, but stopping the bad guys, right? Trying to
Yeah.
take people who were doing things that maybe were on the other edge. So you add all that up, and Lee, what's not fun about that? I mean, that's a great job. If you focus on that part of it and not the 5500s and DOL audits, it's a pretty cool job.
I love that. Great way to frame it, and couldn't agree more. So, to get results like you had that were so different than the norm, mathematically, you had to be doing things that were very different. And trying new things and pursuing new paths is critical to improving the system. I'm curious if you could tell us about maybe one or two large risks that you took that paid off.
Yeah, and so you're right. I mean, the status quo is never going to get you where you want to end up, is it, Lee? Um, one of the things that we did early on was we decided that when we were working in our pharmacy benefit, that we were going to try, instead of using the PBMs network, that we were going to try to direct contract with pharmacies, not pharma, but pharmacies. And so we started to explore that. And of course, everyone told us we're crazy. You can't do that.
Yeah.
No one's done it before. We said, we don't like AWP. We want to invent something new. They said, you're stupid. This will never work. We started thinking about how we do it. We talked to our PBM. They said, yeah, you can go talk to these pharmacies. And if you get a contract with them, we'll build a statue in your honor outside our headquarters.
Oh,
And so we thought challenge accepted. And
yeah.
we really dug in and started to figure it out. And sure enough, we did. that we were able to start doing direct contracting. We started first with a contract with Walmart, then Walgreens, and it went on from there. Where I think by the time I left, I think that 95% of our pharmacy spend was going through contracts we owned with a cost plus pricing methodology versus AWP through the PBM. And that saved us a lot of money.
Wow. What was the conversation like internally to get that done? I can imagine a lot of people listening might think, "Ooh, that sounds really neat," but what will my boss think or my boss's boss?
Yeah, and you're right, Lee. I mean, so I always feel like I was a little bit lucky. I feel like during my career, the last half of my career, when I really focused on global benefits for that matter, all over any benefits all over the world, but my heart was always in healthcare, U.S. healthcare, because it was such a fun challenge. But I felt a little bit lucky in that I did get a little bit of rope over time as we've proved that we could do some of these things. But back in the early days, it was not so much that way, right? And
Mhm.
so the luck I had and the benefit I had was that Caterpillar, where I was working at the time, was a Six Sigma company, right? And
Mhm.
that meant we really focused on facts and data. And so if you brought facts and data and a process in and shared that with leadership, they tend to give you a little more attention. But that didn't mean it wasn't easy. I mean, there's lots of crazy stories to go from starting at zero to getting some of those first contracts signed. I was trying to think of one the other day, and one of the craziest ones was I remember the very first time we had like the Walmart COO and some of their senior leaders into the office, and I had our CHRO in there with our leadership, and everyone got all excited. Everyone agreed this was a good idea. We should do this. Let's make a run at this. And everyone was all gabbing. Everyone just started throwing things out, ideas out. And I remember the Walmart leadership, I think the COO maybe said, we could even do things like, 10% off fruits and vegetables, for anybody who has a contract with us. And it was just this back and forth going on. And so the project worked well, and it took us a while. We had a lot to figure out, and we finally had it all figured out. We had a framework of a contract. And
Huh.
I went back then to the CHRO and I said, I think we got it. I think we've got this figured out. And I laid it all out and they said, I don't see 10% off fruits and vegetables in here. I
Ah,
was like, what are you talking about? And then all of a sudden I remembered this throwaway comment in the meeting, and the whole thing about went down because we didn't
no.
percent off fruits and vegetables. So I had to go back to Walmart and say, hey, we got to figure this out. Your leadership threw this out there. I know I feel like it was tongue in cheek, but I mean, that's not how it was received on our end. And then
Oh, no.
we spent a month probably trying to figure out how they could do that if we had to have a special card, and the timer systems
Oh.
wouldn't do it. And the whole project almost came unwound because 10% off fruits and vegetables. So finally I had to go back to the CHRO, and I just said, I need your help here. I said, I've been beating them and pushing them hard. And I said, there's no deal without 10% off fruits and vegetables, but they just can't do it. The whole thing's going to implode. He's like, how much money do you think we're going to save? And I laid it all out for him. And he goes, okay, go ahead and do it. So no one knows that, but the whole deal, the whole initial direct contracting initiative about fell apart because I could not get 10% off fruits and vegetables at Walmart.
What? Like, but that's fine, but only beets. That's our
Yeah,
compromise. Uh,
exactly.
One thing I love about this is I speak to groups all the time who think, oh, well, Caterpillar is brilliant. They've got a whole team of, contracting experts they've hired or whatever. There's a mystique that becomes associated with sophisticated large employers that thinks, oh, well, they've got it all figured out and I couldn't. What you just described to me sounds like sounds like a brainstorm with a bunch of people who don't have any specific experience or expertise in this area, where 10% off fruits and vegetables seems like a really good rallying cry for the fact that, hey, nobody who was in that meeting had it all figured out.
Yep.
And that didn't stop you from giving it a try.
You're right, Lee. And I think that's one of the big misconceptions that when people are get at wanting to innovate and thinking, do we want to start going down a path where we really want to innovate and try to take waste out of the system, only pay
Yeah.
for evidence-based things? I think they look at the companies and the leaders who've accomplished that and say, well, there's just no way we can get there. And, if they sat down with any of us, you'd hear stories like this. I mean, You just you gotta walk into the storm, embrace the chaos, and look at it as a fun challenge. I mean, and that makes it so it just frames it differently in your mind, and you know it's not going to be easy. And you know there's going to be hiccups, and you got to figure out how to overcome them. I described to you one little funny story. I could probably sit here. We could probably spend our whole time here me telling you stories about how we started to get to the signed contract and execute it. I mean, literally, there's probably another 10 stories I could tell about how chaotic and how crazy and but it ends up good. And then it saved us millions of dollars over the decades.
Wow.
And so that's what's fascinating to me is that you really can do it, but you just got to think of it as iterative. You're not going to start where those who've been doing it a long time are at. You're going to start, you're going to move down your own path. And anybody can do that. I'm convinced anybody can do that.
Everyone, now just a quick word from today's sponsor.
Mom, are you crying?
No, sweetie. Just some allergies. Come here. Let's go play. Come on.
1 in 4 Americans had trouble paying a recent medical bill. Many of these people affected work for companies just like yours. Start giving your employees 100% medical coverage with Catalyze Health.
The other thing I love about the direct contracting story is you might think, oh, the other party's got it figured out. Even if I start to try and do this, maybe I'm going to get laughed out of the room because I don't have it all figured out and there's this big asymmetry. But this also shows that your counterparties haven't got it all figured out either. And if there's any invitation to try and do something new or different and not to be scared of it, I think it's this encouragement.
Yeah. And again, what you don't know, you'll find help. There's always people that'll talk to you. At that time, I had a zero knowledge and big gap in supply chain economics for the pharmaceutical supply chain. So I brought in Josh Bellamy. He helped me figure all that stuff out. So there's people out there that'll help you. They're non-conflicted. And you find those people and that's how you make it work. And that's what we've done and partner with people like that. They're non-conflicted and they bring some of the expertise that maybe we wouldn't even have access to if we wanted it.
What was ultimately your biggest, and I don't mean to put that much pressure on it. Like, what are some of your big successes? What were the big wins that you had as you look back over the past, decade or more?
Yeah. I'm going to paint this with maybe a little bit of a broad brushly, but something that struck us that I think was transformational in how we approached it is, when we first started to try to attack this flat trend project, the pharmacists hate it when I say it, so I apologize in advance, but I think pharmacy's the closest to a commodity in healthcare. It is not, I know it's not, but it's the closest to. And so we really put our first focus on that. Let's see what we can do here. And the strategic decision we made that kind of framed all our decision making is we said, let's carve out everything that's strategic from the supply chain and bring it in house. Because we kind of thought all these people are making strategic decisions on our behalf, and our interests are not aligned. They may act like they're aligned, but they're not aligned. When it comes down to it, they make strategic decisions that align with their business model, and they're making the decisions that impact us that we just didn't have that much insight to. And so we carved out from our PBM all those strategic things, whether that was building networks like we talked about, or managing formularies, or contracting with pharma, or whatever you want to talk about. We took those kind of strategic things and started to try to bring those in house. And I think that maybe was what resulted in our biggest success, is that whole mindset shift of why are we letting other people do strategic things? We don't let them do that in any other part of our company. Why are we using it as an excuse here? Well, that's not our core expertise. Well, guess what? We're managing it and it's a huge spend, so we better make it one.
Yeah. Yeah. Going a little further into that. So I'm thinking for people who are listening, if they're running a health plan, they don't have a lot of extra staff and maybe they don't have permission to add staff. What do you think are a few strategies they could use to start breaking up some of the logjam of middlemen control and opening that up to where they can start building that expertise, even if they can't go out and hire somebody new right now?
Yeah, I love that question because it is one of the true root cause problems for people who want to innovate, and it creates the process, um, creates a process that makes it challenging for them to succeed in. However, what I've found over the course of my time managing this is if you can bring the right business case to the right people, people listen. And so a lot of it is, I made some bold commitments of what I would be able to do if they let me have headcount. And I used to joke that every time we'd have a new accounting regime come through, I'd have to sit down again and explain my staff to them. And I'd say, look what we're doing. Here's what we've done. Here's the data. Here you want to look at the data. Here's this. Here you can have it. Go ahead and evaluate it yourself, and tell me which part of this you want to stop doing.
Yeah.
And they always came back a little bit. Okay, we get it. Just keep doing what you're doing, right? And
Oh, I love
that's
that.
one of the big things that we did. So let's say and to start off with, you may have to hire someone like I did to help fill the knowledge gap until you can build a little bit of it internally yourself. And some people keep that model forever if they found someone non-conflicted that they can trust. That's rare in this industry, but they are out there. Like I said, I found Josh, and that was someone who's always been non-conflicted that I could trust. But otherwise, you go in and say, "I- we don't have the bandwidth to do this, but we think there's X million dollars on the table. Give me a head count. If I don't pull it in a year, then just take my head count away." And you'd be surprised how often that works. People are just scared to ask. Most companies are looking for ways to bend this trend, even bend the trend, let alone flatten it. And if you come in with a real story that you can do it, you'd be surprised how often you can have some success there.
Here's what I want. Give me the head count. If I can't deliver, take it away.
Yeah, I said that all the time. I even one time in the downturn, the company we were getting ready to do some layoffs even, and I went up and I said, listen, give me 3 people and I'll save you a bunch of headcount because we'll drive that value out in a different way. I need more people to do it though. And they said, okay. And we did it. Right. So
Wow.
it's all about the story and the business case. And if you have the data to show it and you're willing to, you know, you can put a little something behind that. If
Yeah.
you're willing to stand up and say you can do it, then you can make it happen. You can make it happen. Lee, one of the big problems is none of us sit in the chair I said and never get fired for saying, "Hey, we saved $1 million with our new contract with our carrier or our PBM." In reality, you should have said 10, but you don't get fired for saving 1 million. So if you want to save the
Right.
10, you maybe have to step out a little bit more. And I think that makes jobs more fun and more engaging.
Did you ever change the way you or your team was compensated based on taking bigger bets? Because any uh, any of the capitalists listening right now are going to think, man, if I save 10 million instead of 1 million and it's more work, more creativity, more risk, I'd love to get paid a little differently from that. I don't know if that ever came up or if that's a best practice.
Yeah, so no. I mean, there's no back in the days of Six Sigma that I referenced earlier, there was some shared savings with that program specifically, but it wasn't specific to what we're talking about here. And then of course we were a merit-based organization. So if you deliver results like that, it showed up in your merit and discretionary pay and things like that, right?
Makes
Um,
sense.
and so
Plus the ability
that's
to
where it
add
shows
head
up at
count.
is in results. If you deliver the results, if you have a merit-based organization, then that's where you end up getting compensated. We never tried to say, hey, if we save 10 million, can we split 1 million of it? We never tried to save that. You know,
No, but your point is still the same. I'm thinking about it in short-sightedly. It's you do well, you gain trust. You gain trust, you gain more freedom. You're able to get 3 new hires in a downturn. Nobody else in the organization's getting that. I mean, you were being rewarded for it. It wasn't done by an algorithm. One question that came to mind. So you always brought receipts. I think this is a really important point that you were tracking your own programs, you were showing what they delivered, how they worked, and what the results were. And you had that ready to go. And anytime an accountant came through and said, hey, you guys are really overstaffed, why don't we try and reduce this down? You had your case studies there to show, no, this is the value each of these people is delivering and how it comes together. And you use that not just to avoid reductions in force, but to actually grow the department and offer more services. what I was wondering is, did you ever do that preemptively? So if I have somebody who says, man, I want to follow and do similar to Todd, how would you coach that person to create a case that they could then submit internally in order to get more headcount?
Yeah, and so one of the things that we always have done is we've always had some in-house data analytics for healthcare. And that
Okay.
over my career, that's been challenged quite a few times. I've never had trouble keeping it, because having that in-house analytics gives us a lot more credibility than saying, well, here's what a consultant said, or here's what a carrier said, or here's what the PBM's reporting says. Because for right or for wrong, a lot of people just don't trust that messenger. But when we
Right.
came and said, hey, here's our analytics, here's what we looked at, here's how we would do it, and here's what the results are going to be from it, and then we'll validate that on the back end for you. We did all that. It just brings a lot more credibility. So now, in the short term, again, you may need to find a way to bridge that gap, if you don't have that in house. But so more and more companies they're recognizing the value of it. They just now need to figure out not to use that position as just a reporting tool, but as a true proactive analytic tool, right? I feel so many folks who
Right.
have in-house analytics just use it for reporting, and it needs to be more than that if you really want to drive change.
Oh, I love that. Tell me about a time you had to get good engagement in a program, because oftentimes we put in programs that can save money, but all the advanced planning in the world doesn't get anywhere if people don't know about it. And I'm curious about how you would drive engagement, assuming that was part of the saving strategy.
Yeah, that's a super question, Lee, because it's always a challenge, right? And
Okay.
so my answer is a little multi-pronged. It really depends on how important it is for you to get the engagement. Because the fact of the matter is, much of healthcare is counterintuitive. And you think you're going to throw somebody incentive and they're going to come running to grab it. And that it just doesn't happen. It just doesn't happen. You'll never capture all of it by doing that if you want to drive engagement. Um, and so if it's something that's like, hey, here's a, I'm gonna I'm going to call it an amenity. Here's an amenity product, right? Where we
Okay.
know it'll do good, but it's also something we just want to make sure we offer for people. Then it's just standard change management, communications, et cetera, et cetera, et cetera. Then because we want people who want it to see it, they'll see it and they'll access it if they like it. But secondly, if I need the engagement to drive my results, I always like to use the term, I use a carrot flavored stick. Um, I like people having choice. But I like there to be consequences to that choice. So, do you make a good choice? This is going to be better for you. You're going to save more money. You don't have to make this choice, but if you choose not to make this choice, it's going to cost you a little bit more. And you would be stunned how much more engagement that drives versus saying, "Hey, we'll give you a $50 gift card if you do this."
Yeah.
It's stunning. Let me think of an example. I'm trying to play off some of what we talked about already, so I don't have to go into too much detail. But think about the
Yeah.
direct contracting, right? For
Okay.
pharmacies, we direct contracted with pharmacies. So
Yeah.
we wanted all of our membership to use those contracts because they were better.
Makes
But
sense.
we knew there's people who maybe were specifically attached to a pharmacy for a certain reason or blah blah blah. So and it turned out to be true. I started getting phone calls. I can't believe you're not going to put this pharmacy in the network. I've been going there since I was a baby. Blah 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 blah. And so I was able to say this: good news. We are going to have the broader network yet. And for like the generic drug you're talking about here, it's $5 differential, $5, not a big deal at all. And so you can still use that if that's important to you. You know what we found? Over 90% moved for $5.
Wow.
For five
That,
dollars. Now,
that's a
I could have
great
framed that as
message
we're going to give
though.
you a $5 incentive if you go to one of these, and we would have seen 30 to 40% movement. I've got multiple stories like that, Lee, where you see the engagement being driven by a carrot flavored stick. In other words, we're trying to find a way to keep your costs down. We're going to keep your costs down if you do this. If you choose not to do it, your costs are going to go up, but we're leaving that to you. We're trying to find ways to keep your costs down, keep your premiums down. And that's really been a key message driver for how I've helped drive engagement into programs that I thought were really important. Does that make sense how I described that?
Totally. What I love on this is that you knew disruption would occur, but you created a soft enough landing that, hey, there's only a $5 difference anyway, which that's a light enough answer that you almost say that to anyone. And it's, there's only so much being upset somebody could get with that kind of a change, but you were still able to get the result you wanted, even with a small differential. So for those who didn't make the change, it wasn't heavily punitive, but for those who did, but most did. Most took it anyway, and you got the desirable outcome, which I love. I I wonder about unions. I know that a lot of employers have a hard time negotiating newer innovative strategies to bring in with unions that generally don't like a lot of change. And you've had great relationships with them and have had a lot of success putting innovation in alongside your union counterparties. I was wondering if you could give us some coaching on how we can work with unions to get to aligned goals with change.
Yeah. So I think, first of all, our labor relations department at Caterpillar is really good, and that helps. All right.
Yeah.
They really understand how to work the best way to work with them. And so I've leaned on them a lot. I can remember some of my early times going through contract negotiations with the union talking to the labor people saying, "You're crazy. That's not how this is going to go." And then it would go exactly like they said it would. And so I learned to listen to the smart people. But so how, from a benefits perspective, have we worked so well with the union? It's the same answer, Lee. We bring them real facts and data. We say, listen,
Okay.
this is how, we're structured with you now. This is the current environment. We're willing to keep this environment. If you want to keep this environment, we can negotiate into this framework. However, if you would allow us a little more flexibility in how we manage these benefits, we can do this. The reason we can't do that in the old way is because we're locking ourselves into something for 6 years. We have no ability to adjust to market dynamics. But if you allow us a
Yeah.
little bit of flexibility to adjust to market dynamic, we can do this. And, I think most unions are tentative in that kind of environment. But over time, I think we've earned a good partnership with them and a good trust, where we talk to them, we let them know what's coming. We talk to them about it. We get their input on it. We even have asked them to help us change manage it sometimes. And so I think that's what's happened there. A lot of wisdom from our labor team, and then our willingness to say, listen, from my chair, this isn't a combative environment. I'm trying to figure out how to get your union membership the best value for their dollar, and that's all I really care about here. And that, I think, has helped get there. We did, and we're at a good place right now with that, and that's because of that, I believe.
Makes perfect sense once you had established a long track record of success and wins that you could earn a lot of trust. Tell us about this. Tell us the story of the first time you had to pass something through that was going to be unpopular when you didn't yet have all that trust and how you got it done.
Well, again, so for the sake of time, I'm kind of using the same kind of environments so I don't have to give too much
Yeah.
background,
Like the
Lee.
direct contracts or
Yeah,
maybe
direct
the
stuff. So
pharmacy
let's in
sourcing.
pharmacy, what we've done over time is we've, in essence, we have clinicians on our team. We partner with other clinicians and external orgs, and so we kind of manage our formulary that way. The PBM's involved with that because they have to, help us adjudicate it. But we didn't do that all at once, though. Guess what? We started class by class. Let's look at this class of drugs. Let's figure out the most cost-effective way for people to get their best outcome, because that was always the goal. The best outcome at the lowest cost. We don't want that. We don't want to sacrifice the positive outcome, but we don't want to waste money getting there. And so when we first started doing that, there was a lot of pushback. And so how did we handle that? Well, we handled it multiple ways. First of all, we educated our leadership to say, hey, we're going to do this. Here's why we're going to do it. Look at the numbers. Look how much money we're wasting. And this is going to keep everybody just as healthy, if not healthier. Got them on board. When we started rolling out some of these formulary designs, where we have large blocks of people, we send out stuff to doctors saying, hey, just FYI, for your cat patients, this is what's coming. Here's the data behind it. And guess what? If you have newer data that we've seen, please send it to us and we'll adapt it.
Wow.
We'll adapt it. And so we had an open line of communication there. And then in the early years, a lot of us, we took some personal phone calls. I mean, I can, the first ones that come in, who the belief for you to tell me what I can take, um, instead of my doctor. And I would always say, well, I'm not telling you what you can take. I'm just telling you how we're going to pay for it. That's up to you and your doctor, but this is how we're going to pay for it. And then the other thing that I would always do is I remember one phone call I got. This person was like, I drive 4 hours to go to the top doctor in our state for my condition, and they prescribe this, and you're telling me that I can't get that. And I said, hey, I said, I'm not a clinician, but I just read the summary of all this, so it's pretty fresh in my mind. If you're going to your doctor on Monday, like you say you are, ask them tell them this is why this is this way and why we didn't do that, and provide the data back to us so that we can adjust it. He goes, you'll
Yeah.
be hearing from me Tuesday. Guess
Yeah.
guess how long it took for him to call back, Lee?
I don't know.
Never. And you know why they didn't call back? Because they laid that all out for their doctor, and the doctor said, well, that's exactly right.
Oh, that's
But I
wild.
knew that we turned a corner eventually when I got a phone call where a guy calls me and he says, hey, I got a bone to pick. I'm like, okay, what's going on? And he's like, I just got back from my annual checkup at the doctor and did my blood work. And, about a year ago, you made me switch from this drug you'd had me on for a long time to this other one. And we look at all our blood work. The blood work was the same, and some of it was a little better. And I spent $800 less last year on copays. Why did you ever let me take the other drug?
Oh,
And so I was
oh,
like, oh, did my heart good, but you can complain about that all you want, but so my point is, I
yeah.
think people started to learn over time. Yeah, this is, they're changing stuff here, but it's saving me money, and my stuff, my outcomes are as good or better. Because whenever we did that stuff, Lee, we always checked the clinicals on the back end. We knew up front they were going to be good, but we validated it just to be safe. Let's make sure we did no harm with this change a year later, and never did. Usually it's the same or a little better. Why a little better? I don't know. I would guess maybe possession ratios and affordability, but I don't know that for a fact. But yeah, and so that's the kind of thing that we had to change manage, and we knew we were disrupting, but we were very open to a dialogue. Now, that doesn't mean there was a 1-800 call Todd number. I
Yeah.
wasn't encouraging that, but my point is, people who care about it sometimes will find you, and we were willing to take those calls and help them say, hey, send us new stuff and we'll fix it. If you do that kind of stuff, again, you just slowly build credibility, I think, and that's what happened.
I love that. One thing we've talked a lot today about new things that we ought to be doing to better manage our health plans, whether it be data, accessing it, building use cases, tracking results. What about the opposite? What irrelevant things do you see some employers doing that they should do less of or stop doing altogether?
Well, I'll never criticize someone who's trying
Sure,
to
sure,
make a
sure.
difference, right? But what I probably see where some companies who want to make a difference fail is they throw a lot of mud at the wall with point solutions without really having done any much enough due diligence beyond what the point solution is telling them is going to happen. And
Right.
point solutions aren't easy to manage. Especially if they're a bolt-on somehow and they're not integrated into your system somehow. And a lot of them, I mean, they just don't. They tell a feel-good story, but they don't have hard data to support what they're going to change. And so you hear a lot of stories of, oh yeah, we were with so and so for 5 years and we finally cut them loose. Really didn't see a
Wow.
difference, right? Well, that's 5 years of wasted effort that could have been spent on something different. And so I think that's where there's some time wastage and some money wastage, even in that
Yeah.
the attempt to do something right, you're throwing mud at the wall a little bit. And so I don't mind throwing mud at the wall. I just want to make sure that I have a higher than average chance of it sticking. And I like to figure that I always felt like
Yeah.
if I wasn't planning right, doing the right thing at least 90% of the time, then I wasn't doing good enough analytics up front. And and so that'd be one thing I would say. But I'm not criticizing. I respect everyone who's trying to throw mud at the wall. They see a problem, they're gonna try to do it.
I think that's a
So,
good goal is ex- uh, shoot for a 90%. If you're doing it right, you should expect around a 90% success rate. But the inverse of that, I think is reasonable too, is that we should accept a 10% fail rate. that's okay, that not everything is
Yeah,
going to work,
you're
and be ready for
not
it.
going to be perfect. You're not if you're perfect, you're not trying hard enough.
That's right. That that's exactly right. I want to talk a little bit more. We start on vendors.
Mhm.
Uh, what do vendors fundamentally not understand about benefits managers, and what can they change? Like, what should they be changing to do a better job for employers and plan members?
Well, that's a that's a loaded question, Lee. You know, let's start with step one. You know, at the end of my career, I am not exaggerating when I say the number of emails a week I would get from point solutions or phone call temps would be in the hundreds per week, right? I'm not alone,
Mm,
right? I'm not alone. So tell me how I'm supposed to sort through that. So I used to try to be polite and say, hey, thanks to it. I just started ignoring it. So if you're watching this and you're a vendor who emailed me at some point and I ghosted you, I would just like to offer my apologies, but recognize that if I answered all of the emails I get from all of you, that would have been a full-time job. And
yeah,
it just got to the point where I couldn't do it. So I can write a lot of the emails. I see them come through, and I can see all the follow-ups, all the strategy of it, but I just don't have time to do that. So you got to recognize that if that's your strategy to blast emails out, it's just unlikely that you're going to get many hits on that, right? Um, and so, but let's say that I got to the point where, the way it usually worked with me and my team was that we would say, okay, we have an area we're interested in. Do we think we can figure this out on our own, or do we think we need, some kind of assistance to make that happen? And then we would proactively find out who's in that space and start to pull them in. So the next problem they have, Lee, is that I would argue that I could write every one of their pitch decks. I mean, it's like the
ooh,
first 30 minutes is almost exactly the same for all of them. They're all about, the emotional tug, their marketing pitches, right? And that might work in some cases. It sure don't work with me.
right.
It's just a waste of my time. I can even tell them, skip the marketing stuff. We know we wouldn't have called you if we didn't know we wanted to look at this, but they don't listen. They just do it anyway. That's all they got. So here it comes, right? You know, and so that's there. The next failure point for them is that that very few of them have data that they even will stand behind themselves, right? They have the data they need for marketing and the way they've got it framed the way they want to frame it. And so my number one screen with all of them, and it was always this. I said, okay, so you're telling me I'm going to get a 5x ROI on this, right? They said, yeah. I said, how confident are you in that 5-to-1 ROI? They would then spend 5 or 10 minutes telling me exactly how very confident they were on that 5-to-1 ROI. I say,
Yeah,
okay, sounds like you're pretty confident. So are you willing to put 100% of your fees at risk? If we don't get 5-to-1, then we just don't pay you anything. Then watch the dancing begin, right? 90% won't do that. 5 to
yeah,
10% will, and those are the ones I'll listen to a little further, right? Because if they're that confident in their data, then they should. I go to I just told you earlier in this chat, I go to my executives and I tell them what I'm going to do, and I'm confident I'll do it. And I
yeah,
put my personal name and my future behind
yeah,
that, but they're unwilling to do that. That's because they don't have it. They'll say, well, it's just really hard to prove, but intuitively you can see it's right. Yeah, I know. I just told you healthcare is counterintuitive. So,
yeah,
so I won't do that. So that's thing they do wrong. And the fourth problem they have to overcome is more and more, I feel like people who really dig in feel like a lot of these are, they're all funded through venture capital and stuff like that. And they're all building to flip, right?
yeah,
Right. So I'm looking for people trying to solve problems long term, but most of them are looking to build to flip. And sometimes the flip is a buyout just so the new idea doesn't take root,
yes,
right? They'll try to buy
yes,
out the innovators if they think they're going to be a challenge to the status quo. Other times they flip. I don't have any good stories to tell you about a buyout or a flip that I thought, wow, that really helped us through gas on it. Now I can write the statement they make when they do it about how this extra capital, blah, 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 how it's going to help fund us, how we're
yeah,
going to be able to expand quicker, but it doesn't happen in actuality. So you add all those things up, and that's a lot to overcome. But that doesn't mean you can't, because they're out there that have done those things, and it's stood behind it. And so That's the challenge. We need to fix some of these problems. How do you make sure that they'll back it? So that was a long answer, but I told you it was open a can of worms there a little bit.
Everyone, now just a quick word from today's sponsor.
Oh, I heard you got off social media.
Yeah, actually, it was just kind of depressing.
Did you know that 1 in 3 fundraisers on GoFundMe are for medical bills? And many of these people work for companies just like yours. Start giving your employees 100% medical coverage with Catalyze Health.
How do we design benefits and programs that people love?
Well, you probably won't like my answer here. We don't. Right? I mean, Lee, what do all of us who have benefits want? What do we want? We want everything covered at no cost.
Yep,
Right?
that's right.
And
That's
if we
right.
don't get that, it creates unhappiness. And so, those who are striving to have noise mitigation as a strategy will never innovate.
Ooh.
Now I'm being a little harsh here, maybe, right? I mean, I'm not saying we're purposely trying to poke the bear here, get people worked up. That's not what I'm saying. I'm just
Sure.
saying if your strategy is noise mitigation, you're never going to innovate, because
Yeah.
people want everything paid for when they want it all the time, and that's not how it works, And I'm glad that people trust the providers in their system, that they're always giving them the evidence-based best practice, but we all know that's not possible. The data changes so fast and so often. And so we don't do that. So what do we do? Right? What do we do? Is that we try to let people see we're designing things that are going to help you stay healthy at the lowest cost to the company and to you, because that's very true. Every time I save $1 million, a portion of that $1 million is plan savings, and a portion of that savings is going into the pockets of the people who use it. Right? And so
Yeah.
that's why we talk about waste. Right? We're trying to remove waste. We're building waste-free plans. What is waste, Lee? I mean, so that term is thrown around a lot. When you ask what Todd's definition of waste is, if it costs $100 to make someone to get the clinical outcome they want, and we spend $200 to do that, we wasted $100.
Yeah.
Every penny we spend more than we need to get the clinical outcome that's desired is waste. And so that's the kind of plan we need to build, and that's the culture we need to talk about within our plans and our employees, to say, listen, this is what we are trying to do for you, and this is how we're going to do it. And so that's maybe not the answer you were looking for, but that's how I view
right.
too many people are too worried about, let's send out a survey and find out what everybody wants, because all that does is a laundry list of random benefits that people want to have for free, and we all can't afford that.
Right. And so just asking it's misdirecting, because then people expect that you can deliver what they ask for,
Exactly.
but it's not a
Why'd you ask
Santa
me if you're not
Claus
going to do
world.
it? It's a negative engagement tool, I think. I quit sending those
Fascinating.
surveys out. You can get that data from lots of places, but I chose not to get it from my employee population for that very
From your
reason. I think it
employee.
creates a false expectation. That doesn't mean we're not watching the market. I'm not saying that. We definitely are watching the market, but
Yeah.
that's not my data point.
That's really interesting. So what would you use to guide priorities? Because if you weren't going direct to employees, certainly you're seeing different solutions, you're taking in pitches, you're looking at your own data. Maybe walk us through that process of how you would find and prioritize problems.
Yeah. So there's I'll keep it brief for the sake of time. There's two ways to do that. Number one, we do our own data analytics to find out what cost drivers are. What's our cost drivers? Okay, and which ones are growing and which ones are shrinking, so we know what to get ahead of before it becomes a problem. The second thing is we do utilize public benchmarking, right? So we find out where our plans are positioned in the market, and so we can have targets for that. So we know how rich or poor our plan is, and we make sure we have a targeted range that we try to stay within, as far as the richness of our plan and the design of it. And that also includes looking what kind of new benefits or what new plans might be starting to take root in the market, so we can stay that. People tend to forget that the reason we exist is to attract and retain,
Yes.
right? That's what our job is. We have to have rich enough benefits to attract and rich enough of benefits to retain. That's our mantra, and that's the business behind what we do. I think sometimes it gets lost in the shuffle.
Y'all were very sophisticated with data. You probably had a dashboard of major performance indicators that you were watching like hawks. What are the key performance indicators that you absolutely needed to run a health plan, and especially if any of those might be non-obvious?
Yeah, I mean, I think the obvious ones are what everyone looks at, right? I mean, I won't have time to go into the depth of what the team what looked at and evaluated. I mean, you'd probably, I mean,
Yeah.
to the drug level sometimes, right? We're looking at cost
Okay.
drivers and trends and stuff like that. And so that's the kind of stuff we could try to get ahead of. We also try to look at to get ahead of trends before they become big problems. I'm trying to think of an example. I remember a few years back, I don't know if you remember this, Lee, there was a kind of a problem going around the country where all these compound pharmacies were popping up and
Yes.
compounding common things. But then since they kind of slipped through the gaps of contracts of how, those drugs were, and they were charging immense amounts of money. So we had found and fixed and closed that off before it even was printed in an article anywhere. Right.
Wow.
Right. And so that's the kind of stuff that if you're really trying to be proactive, you can find and get ahead of before it becomes a big issue.
I love that. Honestly, as well, I think everyone consumes similar types of things. What are my gross allowed amounts? How's that going? What are my how's my actuarial value balancing? Is it on path? I think people are looking at their medical versus their drugs. They're looking at branded generic versus specialty and things like that. But tracking each category year over year and looking at the trend by category to suss out new and upcoming risks, I think that strikes me as something that gets a little beyond the common. What do what is something that is true in our space that many of us just don't understand, that you find yourself having to teach people a lot?
Hmm. Um, you know, Something I frequently say that I don't think people get is people forget that we have the money that the supply chain wants.
Yeah.
And they'll act like they won't do things, but at the end of the day, they want our money. And so I think people forget that, and they listen to, oh, they can't do that. Oh, I asked and they said they can't do it. You know, I had someone call me not too long ago that said, yeah, I've heard you talk about direct contracting and medical, and I called our carrier and they said they can't do that. And I said, well, that's funny. They've been doing it for me for 20 years.
Yes, exactly.
Exactly.
That happens all the time.
It happens all the time, right? And I could tell you story after story of a supply chain entity that said, we don't do that. We can't do that. And I say, okay, so I'm going to find somebody who will. See you later. And guess what, Lee? Magically, at the last minute, they figure out how to do it. They can do it.
Mm.
They just don't want to do it. Right. And I get why they don't want to do it, but I wouldn't want to do it either. But again, who's paying
Right.
who money? So why is the people receiving the money dictating what can be done? I never get that. So that's
Mm.
something that I think is true that people forget or don't understand or believe. But we could do a whole call on stories on that, Lee. I probably couldn't tell them all, but there's a lot of good stories out there that I've seen in my career. Maybe sometime if I see you, we'll have a beer and I'll tell you some.
So ask bold. That to me seems about
Ask bold
right,
and follow
and
through with it though, right? I mean,
follow
sometimes you
through.
just gotta say, okay, it's been nice working with you. We're going to market to find someone who'll do this. You're welcome to compete, but we're going to market to find someone to do this. And magically they appear.
Wow. How about the opposite of that? What is something that you believed in your heart that you later learned was wrong? And how did you go through that discovery?
Hmm. Let me go back a little bit to we kind of brushed around earlier, and that's I really believed that we could drive behavior through incentives. I really thought that just made sense to me. I mean, if I wanted to do something, let me reward someone for doing it, and I think that will drive behavior, and it's a way to share those savings with people and all that kind of stuff. I really thought
Yeah.
that that would be the case, and I think some people still would disagree with me on this, but I've got too many stories of uh,
Yeah.
of that not being the case, and and when I did do it the other way, when I started to offer carrot flavored sticks, boom, all of a sudden I got the movement. And so there's a lot of programs out there, and I'm not trashing them. I mean, there's even things that we do that have incentive tied to it, right? I'm just
Right.
saying that's why I think when we talked about this a little before, you said, how do you get engaged? I said, well, it depends on how much I really need.
Yeah.
Right? If I'm trying to do a proof of concept and I just want to see what happens when I do it, yeah, I might incent people to do it and see if it really, if the concept works. And then if I find it works, I may have to tweak my
Ah.
design to move to a carrot flavored stick, because now I need to move people there.
Oh,
I
that's
think
really
that's something
interesting.
that's way overthought, that incentives are going to drive a behavior change. In reality, they just don't that much. Not when you need to move a lot of people.
We talk a lot on this podcast about running pilots as a way to baby step into innovation and hedge risk. And the concept you just brought up, I think, is really good right there. It's that, hey, if you are running, especially if you're running a pilot and you just need to see if something works, that might be the time to roll out a pretty rich incentive around it so you can quickly and efficiently gather the needed performance data and outcomes data to see if it works. I love that as a best
Yep.
practice of don't roll it out wide, do a minimum viable project, get the concept into market, and put in place the incentives you need to quickly gather necessary data.
Yeah,
I
I'll
I love
expand
that
on
as a
that a little bit. You
component.
said pretty well, Lee, is that some things are hard to pilot, as you well know, right? It's hard to
Right,
real pilot, right? And so
right.
sometimes the pilot is roll it out wide, but just put an incentive on it. And because then you always get some movement. I'm not saying incentives don't result in any movement. I'm just saying they don't result in all the movement you want.
Yeah,
And so yeah, you roll something out wide and make an incentive for folks to do it, and that gives you enough data to see if it worked.
yeah. Now, if there are people who are early in their career who may not be super sophisticated yet in benefits who are listening to this, what advice uh, might you share with them about the next steps they ought to take in their career and managing their health plans?
Yeah. So the best advice I give people who, because these are the folks who really are trying to learn, right.
Right.
So pick your friends
Yeah, if they're
wisely.
in this audience, they're definitely learning.
Yeah, pick your friends wisely, right. And so when I say pick your friends wisely, find people who've done what you want to do, or if you're hiring advice, find non-conflicted advice. It is very hard to do, but it's not hard to ask the question. Tell me all the folks that pay you money. Where's your revenue streams? I want to know all your revenue streams. Do you get any revenue streams from here? Do you get any revenue streams from here? Yeah, would you put that in writing? Because I mean, that narrows out a lot of conflict, right? You got so many scenarios where, they're consulting on one hand, but they're getting the back end kick in from whoever they consult, drive people to. And so find good friends, and,
Mm.
mentors in the industry. You can find people who are doing cool things, right? That's not hard to do. Um, but also, like I said, you're going to hire for it. Make sure it's non-conflicted advice, or people who aren't just stringing you along for money. Just find the people who are in it for the sport. That's always what I like to say. I like to work with people who are in it for the sport. And
I love that.
I make some money on the side because that's how I needed to eat. But I'm in it for the sport, and those are the kind of people I like to use as mentors and partners, and people who want to really make change because they're trying to do it for a good reason.
Oh, I love that. What a terrific way to finalize for today. If someone listen to this is interested in connecting with you and learning more about what you're doing now, what's the what's the easiest way to connect or to reach out?
Yeah, I'm trying to retire, Lee, but I'm finding it hard to do.
Okay.
So, but I'm on LinkedIn. You can find me there. Happy to be your friend there, whatever they call it. Happy to connect, I guess we call it there. Or you can email me at todd@bisping.org. I'm not like you won't get a response in 30 seconds, but you will get one. And so that'd be another way that you could get a hold of me.
Terrific. Well, hey, this has been wonderful. Thanks so much for joining us today on Broken Benefits. Thanks for joining us on Broken Benefits. If you enjoyed today's episode, please subscribe to our YouTube channel or on your favorite podcasting platform. Also, please share today's show with a friend or colleague. It's free to do, and it helps us spread the message to as many people as possible. Until next time.